January 31st, 2023, adults 18 and over in British Columbia will no longer be subject to criminal charges for the possession of up to 2.5 grams of certain illegal drugs for personal use, and the drugs will not be confiscated. This is not legalization.
On January 31st, 2023, British Columbia will become the first province in Canada to decriminalize drugs such as cocaine, heroin, ecstasy, and meth, following both Oregon and Portugal. It's fair to say that the memes for this political move write themselves. Referred to as the Section 56 exemption, it will take effect for 3 years ending on January 31st, 2026. Under this time-limited exemption, adults aged 18 and older will not be arrested or charged for possessing small amounts of illegal drugs for personal use. The total amount of illegal drugs must be equal to or less than 2.5 grams. The illegal drugs covered by this exemption are opioids such as heroin, morphine, and fentanyl, crack and powder cocaine, methamphetamine, and MDMA/ecstasy. It's important to understand that decriminalization is not legalization. Under this exemption, illegal drugs will not be legalized and will not be sold in stores. Drug trafficking will remain illegal regardless of the amount of drugs in possession. The provincial government hopes that this will reduce the stigma of addiction and encourage people struggling with drug use to seek help. As I said at the beginning of the video, BC is the first province in Canada to attempt this, but there's 2 places that have tried similar experiments, including Oregon and Portugal. Let's dive into those. In 2001, Portugal decriminalized the personal possession of all drugs as part of a wider reorientation of policy towards a health-led approach. Possession is now treated as an administrative offense, not punishable by imprisonment. Here's a clip from a report from The Economist that shows 2 Portuguese sociologists helping an individual who plans to smoke heroin. Now, you'll notice that they are focused on judgment-free communication.
Decriminalization has removed much of the stigma addicts felt and the fear of prosecution that stopped them from seeking help.
Agora fumo muito heroína.
Pois, também não estás com subpressão. It's easy to them to get to us and say, okay, I have a drug problem and I need help. They don't have to lie to us. It's like, okay, I'm using and I'm not afraid to get in jail or something like that.
Since Portugal moved away from criminalizing drugs, they've seen the proportion of prisoners held for drug offenses move from over 40% to just 15.7% in 2019. With most of this decline occurring during the first decade, followed by decriminalization. This radical policy has yielded positive results. Get this, in 2001, nearly 1,300 new HIV cases were linked to drug injection. But by 2019, that had dropped all the way to just 16. And back when the program started, it was reported that nearly 100,000 Portuguese used heroin. By 2021, that number had dropped all the way down to 25,000. Another place that's had its issues with the opioid crisis is Oregon. It's estimated that Oregon has the 2nd highest rate of substance abuse in the US as of 2020. In November of that same year, Oregon passed Measure 110, becoming the first state in the US to decriminalize drugs such as cocaine, heroin, LSD, and meth. Oregon reduced the infraction to a civil citation and a $100 fine. By the way, that fine can be waived with a health screening from a recovery hotline. So far, Oregon has had mixed success. The state has acknowledged that they have failed to adequately track data since implementing Measure 110, but according to the Oregon Health Authority, of the 16,000 people who accessed services in the first year of decriminalization, less than 1% have actually entered treatment. Dr. Andy Seaman from the Oregon Health and Science University argues that criminalizing people costs them housing and employment, which will likely make recovery much less likely.
So let's try a different way than putting people in jail, taking away their ability to get a job, taking away relationships, their housing, the very things that we know support either long-term recovery or substance use with less harm.
The city of Toronto has also sent a similar request to Ottawa asking for an exemption from Section 51. But unlike British Columbia's request, Toronto hasn't stated a threshold and has asked for all drugs to be exempt. the city hasn't received support from the province of Ontario. A couple of questions arise from BC's decision. The first is, how does this rally change anything if people are still using drugs when so many other things are required? Well, Dr. Seaman points out this is really just the first step. The next question turns to safe supply. Where is that going to come from? There isn't really an answer here. As would be expected, there are already companies happy to raise money with the goal of winning those contracts, which will probably never exist, but Lord knows that a valueless proposition has never stopped a Vancouver venture capitalist. Something often not mentioned is that perhaps there could be a correlation between poverty and drug use. Hear me out. Vancouver has the highest poverty rate in Canada. You know what poverty does? Poverty increases stress, it increases feelings of hopelessness, it decreases self-esteem, it decreases social support, and yes, even in a place like Canada, poverty decreases access to healthcare, which often requires seeing specialists, lengthy visits, which means time off work, or paying for prescription medication. Sure enough, as we've seen poverty increase in a place like Toronto, guess what? So has drug use. Toronto has seen a spike in overdoses to more than 1,000 people in the city who died from overdoses in 2020 and 2021, almost double the number of reported deaths in the previous 2 years. These are places where every cohort of graduates find less opportunity, and with less opportunity comes less hope. It trickles down. It becomes cultural. According to Scotiabank, anyone below the median of income earners can't afford rent across Canada. And these statistics are the most troubling in both British Columbia and Ontario, a trend that is only getting worse. Forget about home ownership if you can't even afford rent, of which the top 2 quintiles are priced out anyways, unless they have parents rich enough to step in with a large down payment. Why does this matter? Well, culturally, the trend has always been get a job, meet a partner, get a house, and start a family. Hard to do that when you know step 3 is impossible. Kind of kills the hope for young people, doesn't it? Not to mention, when it comes to areas like research and development for Canada, we fall below half the OECD average on investment in tech and development relative to GDP, way down from 20 years earlier. Which means less innovation, which means less emerging industries for young people to work in. I guess we can all just be real estate agents and mortgage brokers making TikToks and selling online courses. And look, I'm just making the case for young people here. Hope matters. Strip it from people and it's hard to blame them for looking for alternative ways to manage their mental health. As BC's chief coroner, Lisa Lapointe, said, the goal of decriminalization is to reduce suffering and death. It is a compassionate and rational response to a health crisis. The move towards drug decriminalization is a complex and nuanced issue with no easy answers. It is clear that there is a need for a comprehensive approach to addressing the opioid crisis, including not only decriminalization, but also increased funding for addiction treatment and harm reduction services. The examples of Portugal, Oregon, and Toronto all show that there is no one-size-fits-all solution. However, the goal of decriminalization remains the same: to reduce suffering and death, and to provide a compassionate and rational response to a public health crisis. Yes, this is a step in the right direction, and yes, it needs to be followed by more resources to work properly. But until we fix the economy, I say good luck. This program might prove to be false hope. All right, guys, what do you think? Is this an effective approach to treating drug addiction? Will Canada or the US follow this approach nationally? Where do you think safe supply will come from? Will it come at all? All right, thank you, everybody. I love you all. If you could do me a big favor, please hit that like button, subscribe, and ring that notification bell. It would be greatly appreciated.